Well, welcome to Real People, Real Stories. We are so excited to be with you tonight, and we are interviewing, as always, people just like me and you who are having amazing life changes with the power of redox technology. My name is Dr. Barbie Phillips, and I am coming to you from Creation Chiropractic in Fargo, Oklahoma. I have been a chiropractor for 23 years for people and animals. And I'm so excited to learn about this technology because I am naturally minded. I take care of my patients naturally, and this has just been a great addition to our practice. But enough about me. If you happen to be joining our group tonight and you're new to Redox Molecules, I want to tell you just a little bit about them before we get started. First of all, Redox Molecules are native to the human body, and we need them for all our cells to be able to communicate to one another and be able to perform all the functions of the human body or animal body, doesn't matter. So these cells are so important, these cell signaling supplements, and they're tiny little molecules. And our staple product comes in this blue bottle, and it is a liquid that you consume, and you can drink this and put these redox molecules back into our body. Now, why is that important? Because after puberty, we start losing about 1% per year ability to make these molecules. And so our body gets less and less able to heal and correct at the cellular level. So we can restore those levels by consuming these cell signaling supplements. So that's why it's so important. And because they're tiny little molecules, they can absorb into the cells very quickly, and they act like an on-off switch to our cells. They turn the good cells on and they turn the bad cells off. And of course, we know that that's very, very important. When they do this and they help heal cells, it's so important because then it becomes a cascade effect between the cells that are around that. And this just continues to flow through the body. And over time, it helps us create resilience to stress and helps us with our overall health. I will insert a disclaimer here that any information we talk about tonight is not intended to diagnose, treat, or cure any medical condition. And what we're going to hear from our guests tonight is from personal experience. And we're so excited to introduce our wonderful guest tonight, which is Doria Stewart. Welcome, Doria.
Thank you. Thank you for having me on this program tonight.
Yes. So Doria is a registered nurse, and I understand that you have had 42 years of experience in the psych area, medical, surgical, and now gastroenterology. And so you have a wealth of background information, and we're so excited to hear what you have to tell us and how you've incorporated redox molecules into your healthcare. And in order to go through those questions and nice interview, I'm going to introduce you to Miss Kathleen, our co-host. And Kathleen, I'm going to let you take it over, girl.
Thank you so much, Dr. Barbie. I'm Kathleen Oliveri, and I'm coming to you from Mississippi. And so it is nice to be able to join you no matter where you are. And I'm just delighted that Doria has joined us tonight. But before we begin, I believe there's one person who has their microphone on. And if you could just please mute, that would be amazing. I think it's Carol maybe has her microphone on. We just hear a little background, but nothing major. But we are so glad you're watching tonight, Carol. So thank you for being here. Doria, just honored that you spend some time with us. So tell us and tell everybody watching a little bit of your background and just a little bit about yourself.
Sure. So I live in Atlanta, Georgia. I would say I don't live right in the city of Atlanta. I'm about 30 miles northeast of Atlanta. I was not born here. I was born in Delaware and migrated down here about 42 years ago, to be exact. So just like Barbie alluded to, I've done nursing. October will be 42 years. And the various, platforms, like she said. I love nursing. Nursing's always been a ministry to me. I've always looked at the person holistically, so by mind, body, spirit, and mental as well. So that's real important for me, as I take care of my patients. But I'm divorced. I don't know if you want to know that or not, but anyway, I do have one child. She is 37. I have a granddaughter who is 17, and I have a four-legged friend, Harmony. So that's my family. But I love being part of this evening. I love what you guys are doing, and I love being a part of the ASEA culture.
It is kind of interesting to get a background about you because from Delaware to Atlanta, but I would say that that's home now since you've lived there for 42 years. I would say Georgia can claim you definitely as home. It's a hometown lady. Well, good. Thank you so much for giving us a little bit of your background. That really does help us. So tell me, what intrigued you about these redox signaling molecules, or what piqued your interest when you were first introduced to this?
Okay, so first of all, a very good friend of mine who's a dentist, a very renowned dentist here in the Swanee, Georgia area, which is not too far from where I live, actually reached out to me. He knows I'm open to all kinds of modalities, chiropractic care, massage therapy, oils. And he said, this might be something that you might want to take a look at, not only for my health, but also maybe something I could do after I retired. And so I've been, with part of this company for 4 years. So, I said, sure, I'll take a look at it. I really, at first, when I first looked at the information, I thought, I don't really see any need for it because I don't have any health conditions. It's funny we say that. A lot of us deal with things, and I think we're just in denial, especially being a nurse for as long as I have, being at the bedside and working, 12-hour shifts. So, I went ahead and, did a little bit of searching on PubMed, which is the National Institute of Health, because nurses have love their science. But it really wasn't until he invited me to a gathering, like a cookout. He said, we're going to have some people over. You may know some you may not. And when I sat down, just kind of talking to different people, I didn't know that I was going to a gathering that they were going to talk about redox. I was blindly walking in, but listening to testimonies is really what caught my attention. And one in particular was a gentleman that had prostate, or bad cells in his prostate. And I took care of those patients on my floor. And so he began to share with me that he had complications related to that, where he had bladder incontinence, and then he also had chronic pain, and that he had gotten hooked on opioids. And I didn't know, my patients always stay 23 hours and go home. So I didn't realize that, that they can have those types of complications after this surgery. And so when he was sharing with me that, he got on the product, his bladder incontinence actually resolved after 90 days. And that just kind of like took me back. I thought, like, there's something to this. This does not happen. So that's when I started looking at more that, at that time we didn't have realredoxresults.com, but there were testimonies out there on another site called Healthy Self. So the more I looked into it, more I delved in it, I'm thinking, this doesn't happen. Like I said, in all my years of nursing, I've never seen anything like this. So, I then decided to, what the heck, go on the product, and see what it can do for me.
I think that's so interesting, you being a nurse and the science really was something that intrigued you. So to me, that speaks volumes about the product just because of your interest and your background. I mean, you were certainly somebody that I would look to for advice about something like this, because I don't have that science background like you and Dr. Barbie do. So once you decided to go on the redox signaling molecules, what did you notice, or did you notice anything in your own body?
Well, I really wasn't expecting anything. Again, I was in denial that nothing was wrong with me, but it has to be. When you work as long as I have, you do have some issues. So, the third night that I drank it, I slept for the first time, I would say, in 35 years through the night. I mean, like a baby. And I continue to do that. As soon as I it doesn't matter what time I go to bed at night, as soon as I hit my head to the pillow, I'm in deep, I guess you call it REM sleep. and I just sleep really well, wake up refreshed. And then secondly, I started having relief of discomfort. And I just, like I said, I was in denial. It's just something you think it's just the nature of the beast. I've been a nurse a long time. It's just something you have to deal with, So I would say probably it took about a month for all discomfort to go away in every joint and in my back and my feet. And the stress level. So as a nurse, it's very stressful at the bedside and has been in the last several years of nursing. And I was just even keeled, like I was like nothing bothered me. So, and then, since then, I would say that I've had like little things like, I used to get bad headaches related to our high pollen count here in Georgia. And I've not dealt with that, in 4 years. So there's like, as you probably and Barbie can allude to, there's lots of little things that kind of, that we keep noticing that, we don't have to deal with anymore.
No, Doria, I think that is really interesting. And I'm very similar to you. I'm like, well, I'm pretty healthy. I'm okay. I don't really I was only taking one medication, but it wasn't until I started to take it that I really noticed, wait a minute, something has changed. And it's been incredible for me. So now that you've been on 4 years, you've probably seen a lot, helped a lot of people. Just kind of reflect back on these 4 years and maybe what are some things that you've seen that really stood out in your mind, something that could be of interest to somebody who's trying to decide, hey, is this legit? Do I want to do this? Or what can you do to help people make a decision?
Yeah. So first of all, I want to say that, health conditions happen at the cellular level, as we all know, but you might not have symptoms for 7 years. So, like people say, oh, I just got such and such. No, you didn't just get that. It's been brewing at the cellular level for a long time. You just started having symptoms related to that. So and it's because these molecules, like Barbie said, we lose 1% every year, but also if we're exposed to stress and environmental toxins, and of course toxins in our food, those things will also diminish the amounts of molecules that are being produced in our cells or in the mitochondria. So it's important though, if you're on redox, to eat well. Of course, you can't be like, like you hear Dr. Lee Osler says, you can't be sitting on the sofa eating a bag of Cheetos and drinking your redox. It's really important, to have to have, good nutrition, hydration, all of that to work well with with the molecules. I was talking to somebody this weekend. They said, well, I take all these supplements, and I said, well, supplements can have a toxicity to them. Our product is non-toxic, and the other thing is if your cell is not healthy, then those supplements that other people take from other companies are not going to do their job within the cell. I mean, they could just, and I think we've heard that from other people that, they take all these supplements and they don't see any difference in, their health. It's because the cell needs to be healthy. And that's what redoxing molecules does. I just want to shortly say about a testimony of a friend of mine. She had a rare eye condition and she was on the molecules, and I had a workshop at my house, and I had Dr. Lee kind of like zoom in to, to be there as a three-way or as for validity. Anyway, he asked her, he said, well, what have you seen? And she said, well, I have had this rare eye condition and I no longer have it. And he said, well, how many drops were you putting in your eyes? As we know, it's non-toxic. You can put it in any eyes, ears, any orifice that you have on your body. And she said, no, I never put them in my eyes. She said, I just drank the molecules. And that was mind blowing to me. I thought that took it to a whole new level. Just like Dr. Barbie said, it has that cascade effect. So those molecules knew exactly where to go in her body. Just gives me cold chills thinking about it. Know exactly where to go in her body, where the greatest need was to begin, repairing and restoring that. And I thought, oh my gosh, this is like, it blew my mind. Always gives me cold chills every time I talk about it. But that was pretty incredible. It just took it to a whole new level.
Exactly.
Yeah.
When somebody is starting these new, what do you normally tell them about when they're going to see changes or feel changes?
Yeah, so I say that, you may not always feel like you don't feel, if you're, taking vitamin C or vitamin D, but always know it's always working and it takes time. I mean, we didn't get in the condition that we were in overnight. So it's a process, and then like, for me, in the first 3 days I slept better or the brain fog lifted, but it took a little while for the discomfort to go. And then almost 4 years for me to, whatever was going on in my sinus system, for the immune system to kind of, kick in and, be all at the optimal, I guess, then I wasn't dealing with that. So it's just a process. And if they'll just hang in, it's going to take some time. And I think we just have to give them good expectations, and I think sometimes we do hear testimonies, well, within 48 hours, I had this major thing. Well, I think we just have to be fair to people and say it is a process.
Oh my goodness, yes, it is a process, and some people will react differently than others. And so, yes, for me, it was like 3 or 4 months, and I'm so glad I stuck it out because it really did make a difference in my body. But if I had given up too soon, I wouldn't be reaping any of the benefits today. So that is so true.
Exactly. Yeah.
So I do want to open this up. If there are any questions that people have, you can unmute, turn your video on. Would love to. So think about that. If there are any questions that anybody wants to ask. And so, Doria, are there any final words before I kick it back over to Dr. Barbie?
Well, I think, I know the 4 years ago, they said this is bigger than what we can even imagine seeing. And it's just amazing. Every year we just hear more and more about what, redox biology is doing. And we have new science that's coming out. What I love about it is there's such, when people say this is a scam or something like that, and I say, if this was a scam, this wouldn't be in 33 countries, nor would like Dr. Barbie and other care professionals, be sharing this. They're like putting their professionalism on the line. But, this is the way, for first of all, our healthcare system is failing us. And it's really important to take your own health in your hands and do whatever you can do. So if you hear about this and it's something new to you tonight, then, like Kathleen and Dr. Barbie can reach out to you and send you the, information that you need. But do what I did, do the deep due diligence, so to speak, and don't discount it, because this is the wave of the future, and it's coming, and we're just on the preface of it.
Exactly. So if anybody has any questions, you can unmute. And while you're doing that, I'm going to turn this back over to Dr. Barbie.
All right. Thank you, Kathleen, for hosting that. That was great. And Doria, what a great wealth of information that you shared. Does anyone have questions for Doria? And you can put them in the chat, or you can go ahead and turn your camera on and your microphone and ask Doria any questions that you may have tonight. All right, I don't see any questions out there. Well, Doria, thank you so much oh, Dana, do you have a question? You want to unmute yourself?
No questions, but that was really, really a clear presentation. Love that. And I'm a nurse too, and got involved. I was a hospice nurse, but for a variety of reasons, I was getting so sick, and I thought, I got to do something or I'm going to need a hospice nurse. And so it's just an amazing technology, and I'm so grateful to hear about Redox. But well done. Thank you.
Thank you, Dana. Thank you. All right. Well, if anyone has questions when they hear this or view this recording, please feel free to contact us at Creation Chiropractic. The phone number is 580-698-2852. And this recording will be shown on our YouTube channel, as well as my personal Facebook page under Barbie Phillips. will also be posted for ASEA associates on the ASEA United page. And so please feel free to share it with your friends and family. We would love for you to do that. So until next time, Miss Doria, thank you again for your precious time. It's always great to see you. And until we see each other in person again, I look forward to that. And our next Real People, Real Stories will be in 2 weeks on Tuesday, September 5th at 6:30 p.m. Central Time, where we will interview another guest and find out how Redox has changed their life. Have a great night, everyone.
Good night. Thank you.
Thank you. Good night.